Hello everyone, it's time for a house call. I'm your host, Kim Becket. Do you have allergies? Are your eyes puffy or constantly watering and irritated? You may be suffering from allergic eye disease. To shed some light on this subject is Dr. Michael Schnell. Dr. Schnell is a board-certified ophthalmologist with the Center for Advanced Eye Care. Hi, Dr. Schnell. How are you doing?
Good to be here again.
It's nice to see you. Okay, so I feel like this is a topic that is so common for so many people.
I agree.
Yes.
As we talked a little bit earlier, certainly this is the season for some bad allergies.
Yes.
Spring and summer, but we also see them in the fall and winter here.
Absolutely.
And there are many causes as allergies, as you well know, and then we have to sort of figure out, is it an allergy or is it something else? But allergies are certainly a large part of our practice.
So when somebody comes to see you, what is the difference between just seeing somebody for a routine eye exam or when you discover, this person has got allergies?
This is an interesting point. We have, if you look all the kids in Florida, okay, or at least the kids that I see, I would say 50 to 60% have signs of allergies, have signs of allergic eye disease. They don't give symptoms, but they certainly have signs of it, okay?
Okay, so what are the signs? Like, what are you talking about?
The signs, if a person doesn't have any signs whatsoever, what we find is we look in the bottom of their eye and we see little follicles. Do you know how a doctor checks for lymph nodes? Well,
yes.
These are really mini lymph nodes.
Interesting.
But as far as symptoms of patients, one of the hard things we have is differentiating between allergic eye disease and other types of eye disease. You certainly have puffy eyes, you have watery eyes, you have itchy eyes. Mm-hmm. Some people complain of pain, some people complain of a foreign body sensation. So there's all kinds of things, but this also fits other diseases. In the elderly, or in the older I should say, it can be dry eye disease. It can be allergies that have nothing to do with what's out there in the world, but rather what people have done to themselves. They've changed their makeup. They've used a different fabric softener. So there can be millions of things that can cause allergies. And the first thing we have to do is make sure it's allergic eye disease. And once we do that, then we can sort of ask them a series of questions and see if it's from what's out there or is it something they've changed recently.
So how do you determine this?
Well, some of the things we do, as you well know, that many of the older people have dry eye disease. That's very common. So the first thing we do is try to eliminate that. We'll ask about symptoms. Is it worse in the morning? Do you feel like there's something in your eye? And then we'll do an exam and we'll see what the cornea looks like. We'll make sure it's a nice corneal film, that it doesn't break up too soon, and that there aren't literally dry spots on the corneas. Once we've eliminated that, then we can go on, and we've also eliminated that it's not a viral conjunctivitis, a pink eye, or a bacterial conjunctivitis, which is even more serious. Obviously, a viral or bacterial conjunctivitis, it starts as a definite starting point, and it doesn't last a month. Some people will come in and say, well, I've had this thing for a month, my eyes have itched and things like that. Well, then you pretty much eliminate viral conjunctivitis or bacterial conjunctivitis. So then the main differentiation is pretty much about dry eye disease and allergic eye disease.
Interesting. I know that dry eye disease is, I think, super, super common with so many people.
Very common, very common.
Now, let's talk about what you can do to yourself, like even the makeup. I mean,
exactly.
Because I can tell you for myself, I had an eyeliner that I was using and I was just going crazy because my eyes were watering and my makeup kept coming off and I just couldn't figure out what the heck it was. I thought that, actually I almost came to see you because I thought I was having something crazy with my eyes.
Well, a lot, you brought that up. Not only can you have external things like eyeliner or makeup, but you can have, like I said, a change in fabric softener. You can have a new pillowcase. You can have all kinds of things.
Things that we don't think about.
But also the other thing for being allergic, many of our patients are on glaucoma drops or even dry eye drops.
Oh, yikes.
Dry eye drops, there's two types. Ones that you can get that have all kinds of preservatives, and then you have an unpreserved pure. Now, obviously that's more expensive, but after time, some people become allergic to the drops that we're giving them, and therefore we have to switch drops. Not very common, but it's certainly seen, especially in Dr. Cadadi's glaucoma practice. So once we determine that it is allergic eye disease, we try to figure out what the allergen is, okay? Is it seasonal? Is it something that we can remove from their daily lifestyle? And when we determine what it is, if it's something we can't get rid of, we start them on some anti-allergy drops. And then there's a stepwise progression. You start them on a basic over-the-counter, at least in my hands, you start them in a basic over-the-counter anti-allergy medicine. And if you don't get relief, then you up them a little bit more to a stronger anti-inflammatory, or sometimes even a steroid. When we were in Vermont, I can remember from middle of June to beginning of August, my wife was on steroid eye drops for the whole time because she was very allergic to oak, and luckily us, we lived in an oak forest.
Oh my gosh. And you just, and I mean, so you moved down here to Florida.
There you go. She's doing good down here, I might add.
Well, Dr. Schnell, hang on to these thoughts right here because we will be right back with some more terrific house call.